Hello, Ms. Sandra Gonzalez. My name is Janet. I'm just going to be asking you a couple questions regarding your mother, Alma Gonzalez, her treatment, and Dr. Patwardhan. Is that okay?
That's fine.
Okay. The first question will be, what type of cancer does your mother have?
My mom was diagnosed with lung cancer, 3A.
Okay. And has she had cancer before?
She did. She had cancer back in December of '05, and that was breast cancer. And she came here to be treated by Dr. Pat.
So she was also treated by Dr. Pat for her breast cancer.
Correct.
Okay. And why would you guys return to Dr. Patwardhan?
Well, very simple. My mom loves Dr. Pat, and she did not want to go anywhere else. It's she feels so comfortable with him that even having a language barrier with him did not stop her from coming back. And that's one thing that always stops her from going to other doctors, but not with Dr. Pat, because she just adores Dr. Pat and trusts him with her life.
So she has a lot of faith in him.
She sure does.
Okay. And how is the office helping her and of course, you and your family?
Well, in many ways. One, Dr. Pat is very dedicated to his patients, to my mom's, to healing my mom. We have complete faith that he will. And the office is such a support system here. Everybody's so wonderful and generous and understanding. Something that you don't find in every office, well, in most offices out there. You do find it here, and that's so important because not only for my mom, but for us as a family to know that we have the support that we need while we're going through such a difficult time. Because this is only not affecting my mom, it affects the whole family.
I understand.
You know? And when we have such a support group here with Dr. Pat and his staff, it just makes life so much better for us.
So they basically, they're very compassionate and they try to give you as much support as they can, right?
Yes, they do. Yes, they do.
Okay, and when she first came in, did she have any type of medical insurance? Was she covered already or no?
She had, yes, she has Medicare, which is what she's had for a while.
Now, due to the restrictions that Dr. Pat has right now, has she ever had any problems trying to fill her prescriptions?
Yes.
Or?
Yes, and that's a very aggravating point there because, yes, after her first chemo, which was a large dosage, her and I went to Walgreens to fill the prescriptions that she needed for after her treatment. And Walgreens said that Dr. Pat was not approved by Medicare, so therefore we couldn't get the prescriptions there. I had a hard time running around that whole day. It was a day of hell because I could not get somebody to do that. Finally, I found a pharmacy, but it was late in the day. I had gone around with my mom being sick and all in the car. It was so frustrating.
Something that could have been prevented, of course, right?
Yes, yes, of course.
Okay, now, has he ever tried to refer her to any other specialist and can't for the same reason, for the same insurance barrier? Or is there any other problems that you guys come to due to the restrictions that he has?
Well, I can't think of anything right now, but everything has been referred and approved by Medicare, so, you know, it's just, that's all we have to deal with. I really can't think of anything right now else aside from prescriptions and that.
Now, just one more question, because I know that,
Oh, I'm sorry, can I interrupt you?
Yeah, of course.
There is one thing. When we first started this whole ordeal, I took my mom through the testing and getting results and all that. I noticed one thing. All the other doctors that we're dealing with were able to get the information, the results from the hospital. They were able to download the results immediately. And we were in a hurry because we were in a rush so Dr. Pat could start treating my mom. Dr. Pat was not, he doesn't have that luxury. He doesn't have the way of downloading the results immediately after the test. So he has to rely on them giving him the results, which take a while. And instead of like all the other specialists that were able to get the results immediately, because all they have to do is download them to their system.
Correct. So that kind of prevents her from getting her treatment sometimes as quick as it can be getting.
Exactly, right. That delays her treatment for her to start her treatment.
Now, one more question. I know that well, most of your mom's family is okay with the decision of her seeing Dr. Pat, but what about the other half when they found out about the restrictions that he had? Were they okay with it, or did they kind of have doubts that maybe he wasn't a good doctor to come with?
Everybody is so concerned about my mom's well-being. Everybody wants my mom to be okay, and we all know from the first time that she had cancer, the mom just adores this doctor. She trusts him so much that it has, turned around to us where we all trust Dr. Pat, and we have seen how Dr. Pat is with my mom. So the majority of the family, immediate and extended, everybody trusts Dr. Pat in spite of what is, in spite of what's happened with Dr. Pat. Everybody has complete faith in him.
Okay. So, would you like to add anything else to Dr. Pat, or is there anything else you would like to say, maybe so you can get the restrictions removed and your mom can get better treatment?
Well, aside from, yes, I would like, the restrictions to be lifted for several reasons. One is because the Dr. Pat is such a good doctor, and he services his patients so well that to make life easier for him, therefore trickle down to his patients, making life easier for his patients. The other thing is, when you come around here, and every time I bring my mom to chemo, and you see all these other patients, cancer patients, who are sitting around, and they're all raving about how wonderful Dr. Pat is, and how generous, how kind, how caring he is, that is something that you don't find very often nowadays with doctors. We think that it's only fair that, the doctor gets his rights back, and that he gets he's able to service his patients better with the help of whatever is needed, and in this case would be to lift the sanctions they have against them.
Oh, well, thank you so much, Ms. Gonzalez. I wish you the very best for you and your mom and your whole family. If there's anything else you'd like to add, we're here for you.
There's one more thing that I would like to say, is that now that my mom has had cancer twice, it only makes the family wonder why, if we're all her daughters, and her sisters, who knows who's next if we are, we are obviously, prone to getting it because of my mom's genes. And we would like, and I hope that, if something was to happen to any of us, we all would like to know that Dr. Pat is available to treat us, and if he is, without any restrictions. Because the last thing anybody needs when they're going through cancer is to deal with extra problems that are not needed.
Correct.
So please lift Dr. Pat's sanctions, because it's only going to be good for his patients. You're not punishing him, you're punishing the patients by doing it.
Thank you so much, Ms. Gonzalez. Really good. Thank you again.
Thank you.
Bye-bye.